Does this make sense to you? Scenario fitting by Sceptikat, Part 6, Did We Save the NHS? Narrated by Andrew Mather. Hospital capacity. Action if acting in the interest of the population. Lift the lockdown. If lockdown measures are instituted on reasonable concern about potentially overwhelming the healthcare system, as soon as it is clear this was avoided, the lockdown measures are immediately lifted. UK government action, switch the narrative, stated goal of lockdown, flattening the curve and saving the NHS. Excess hospital capacity was not needed. In fact, hospitals were unusually empty, yet lockdown measures remained. Instead, the narrative changed. Let's remind ourselves why the lockdown was introduced. UK lockdown put in place to protect the NHS. There was concern about a tsunami of cases overwhelming the NHS, which would have had terrible consequences. Of course, the fears about breaking the NHS were based on flawed models. More about that in Part 7. But after the horrific scenes from Italy, the worry was understandable. But it became very clear very quickly that the hospitals were not overwhelmed at all. Quite the contrary, hospitals were unusually empty. By mid-April, we knew that hospitals had 4 times more empty beds than normal. Nightingale Hospital stood empty. The primary reason, of course, was the flawed model that the government relied on. The tsunami of COVID patients never arrived. Meanwhile, the NHS, preparing for the tsunami, enhanced its discharge process so that patients who no longer need urgent treatment can return home safely and quickly. Hospitals were asked to postpone or cancel operations and appointments except for emergency surgery. GPs stopped seeing patients in person. In addition, some avoided tests and treatments due to their own fears about the virus. Although it was clear by the beginning of April that the hospitals were just not overwhelmed, but were unusually empty, operations and vital treatments continued being cancelled. To add insult to injury, while the country was instructed to clap for the NHS, absurd numbers of videos of dancing and doctors and nurses were circulating on the internet. While more than 2 million operations had been cancelled, the patients who did turn up were sometimes kept waiting by NHS staff while they choreographed their dance videos. Flattening the curve. The logic was absurd from the start. We must avoid overwhelming the NHS because if we did then, it would not be able to carry out its normal functions of caring for sick people. So we will order hospitals and GPs to stop carrying out their normal functions of caring for sick people. Basically saying, in order to avoid coronavirus breaking the NHS, we will break the NHS ourselves. Take that, COVID. Not only that, but when it was obvious that the coronavirus didn't come close to overwhelming the NHS, we didn't reinstate normal service at hospitals and GPs. And we also didn't end the lockdown, even though it was introduced specifically to flatten the curve and thus avoid overwhelming the NHS. Instead, the narrative to justify the lockdown changed to suggesting that the lockdown is a method of virus elimination, which it is not. In summary, concern early on about overwhelming the healthcare system was not unreasonable, but focusing on the vulnerable group making up the majority of hospitalizations, much better provisions could have been made. As the goal of flattening the curve was to avoid overburdening the hospitals, as soon as it became clear that the opposite happened and hospitals were unusually empty, the extremely costly, damaging and dangerous lockdown policy should have been immediately discontinued. Instead, now it is implied that by continuing the lockdown, we will somehow eliminate the virus. Sceptikat says this makes no sense. Join us for Part 7, the Rubbish In, Rubbish Out School of Forecasting Models. Thank you for watching. You can reach me, Kat Sceptikat, at sceptikat@peerlessreads.com. Andrew and Kat see that. Or privately at kat@sceptikat.com.